Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we've got a medical assistant to talk to, the people that get you ready to see the doctor. Also, do you have an arthritic hip thinking about a replacement? We've got an expert to give you different options. That and lung cancer is big in Kentucky. We've got a doctor and a patient to give you their story. All that and surgery on Sundays also here. Well, to start us off is our couple of medical assistants with Family Practice Associates, Ms. Retta Graves and Heather Wallace. Welcome.
Hello. Good to be here.
Nice to be here.
Now, a lot of people can be ruined by LPNs, RNs, CMAs, RMAs. Now, Retta, you're an RMA, and Heather, you're a CMA. So tell me what a CMA is.
It's a certified medical assistant, and I went to school at Kentucky Healthcare Training here in Lexington, and it took maybe about 6 months. It was fairly, I don't know, it was pretty easy in a way, but for me, yeah. That's about it.
So during that, you had book training, you had clinical training.
I did. I had both. So I did some online and I did some in school or in classroom, and it was a lot of information to cover.
Okay. Now, Retta, when you do all this, you go to school. You also have to pass some exams.
Yes, you do. Several. Yeah. I had to do 96 credit hours and 160 externship plus 2 years. I'm sorry, 2 years training for this.
All right. So you kind of learn your task, and you're there to get the patient. So so you take them back. Tell us a little bit, Heather. Tell us a little bit about what you do. Give us the scenario.
So first off, we go through the medical history of whether they've had any recent surgeries or what kind of medications they're taking or what they're not taking, whether they are up to date on mammograms and colonoscopies and stuff of that nature.
Okay. Now, Retta, you do vital signs.
Yes.
People complain about their weight a lot when you have to take their weight.
They do not want to get on our scales. Or they'll say, I weighed such and such at home this morning. And I'm like, well, we can go with that. That's fine. But yeah, they just dread the scales.
Okay. So you get them, you do the vital signs, you get them in there, and you get a history. You got to deal with the computer. That's always an adventure, I'm sure, for a lot of people.
Yeah, technology.
So tell me a little bit about other tasks, Heather, that you might do.
Well, along with that, we do injections, we do EKGs, we do many different things, spirometries. It just depends on what the patient is there for that day and what they have complained about to the doctor or what they want to talk to the doctor about.
Now, Retta, as part of the history, you look at their vaccines. She mentioned injections. So you
lots
try to
of
keep
injections, flu, pneumonia, up to date on the latest, whatever, shingles vaccine. Oh, I've had shingles vaccine. Well, there are 2 new ones, We do the math and see if they're due for it, and procedures, we do a lot of stuff.
So if you get somebody really sick, you also have to deal with maybe getting them a specialty appointment, maybe scheduling with x-ray, maybe getting them to the hospital.
Something stat, like if we want it right away, I'll take care of that. I'll call the hospital, fax them the paperwork, get it set up, notify the patient. Sometimes they are in office. We can just tell them to head that way or be there at a certain time. So yeah, just hands-on, just if we need it, we do it.
Now, I can tell you for a fact that the patients get attached to their doctor because they know who they are.
Absolutely.
But they also get very attached to you guys. They know your name.
Yes.
They do.
And it's and you learn the patients?
Yes.
I do. We do.
Yeah, we do.
Get very attached to them, and then it's hard sometimes.
It is.
And so sometimes you know when they get there, some of the things they're going to say already.
Oh, absolutely.
Oh, absolutely. Yeah.
All right. Now, you also mentioned EKGs. That's sometimes when people are pretty sick. Just explain one to me.
It's a 10 lead. You learn in class where to place those on the body so that they get the correct current going. It's just a test that actually just looks at the conduction of your heart, your rhythms.
And that's something that you guys do that the doctor comes in and looks at. But there are times when, Heather, when you may help the doctor with an exam or a procedure or just be there to help anything that they might need.
Absolutely. So if we do like any type of offer procedures, whether it's being like a knee injection or cutting a mole off or something, we're there to assist them in any way that they.
Or sending something
Or
off,
sending-
like,
sending
you
them
know,
specimen off.
cancerous or something, not, yeah, different things, lots of different things.
Well, we appreciate what you do. We appreciate the care that you give the patients. They appreciate it. And
Thank
thanks for
you.
coming in and give us a little idea of what you do to help Family Practice Associates.
Thank you.
Thank you, sir.
We appreciate it.
Thanks for coming in. We'll be right back.